Where does the issue of the social determinants of health, the issue of racism in healthcare and the disparities of care, which I know you've been concerned about for quite some time, I know that firsthand, where does that figure into leadership and the C-suites across the country? How are they seeing that as part of their strategy?
Well, it's a great question, Zev. I think I would have a couple things to say about the disparities that exist in our communities. One is, I think it's safe, particularly in systems and hospitals, to assume good intent. And when you get a chance to talk to people deeply about how they think about it and how they worry about it and what they do, et cetera, the intentions are always good, or almost always good. So I really don't feel like I see much of a mismatch around that. But I think what we've learned again and again and again in medicine and in healthcare is good intentions aren't enough. We learned it in the original quality endeavors when we got pointed out to us that we were proud of what we were doing, but quality was not nearly so measurably good as patients and communities deserve. We learned it again with patient safety. We're learning it every day as it relates to the cost of care that we are providing. And we have learned it in a most important way as it relates to the disparities of care. And as a physician leader, as a healthcare leader, each of those issues, they should have been our issues. We shouldn't have had to have others come grab us by the lapel and say, hey, you got a problem here. And it has always bothered me a bit, regardless of the wave of, okay, now that we know, we got to take this seriously, we got to move the needle, that we didn't own some of those issues earlier than we wound up owning them. But I think the disparities that exist in spite of good intentions is a national embarrassment and should be one of the driving forces of, at least at the government level, at the regulatory level, of hedging on as disruption occurs. Are we advancing the ball or are we taking steps backwards?